welcome everybody. Thank you guys so much for being here. Thank you so much to Xander, Team Century, and all the players that are in person to come learn about esports health. I wouldn't. It's crazy to me that I had this opportunity to speak to so many people, and other shout outs before I give an intro to myself. Shout outs to 1HP and all the esports journals and literature that has gone to help me make the presentation that you have before you. I would not be here without all of the support that you have given me. So without further ado, my name is Dr. Zachary Platto. For those of you that don't know me, which is very few in this crowd, but for those who are on stream, I am a competitive Smash Brothers player. Here I am at the Central Regional with Jeepers and Grand Finals. I do flow arts and I do calisthenics. I received my white coat in 2021, and I graduated with my doctorate in April of last year. And for those of you who are joining us and do not know, I'm obsessed with raccoons. They are my absolute pride and joy. I will never be upset if I get a DM that's just a raccoon. It will always be a pleasure, and if you take absolutely nothing away from this, send me a raccoon. If there are raccoons in the chat, and that is the only thing I see in my VODs, I know I did a good job and I sold my point well. All right, let's see. So why is this at all important? And I don't think I need to sell it to you guys so much as I gave this talk to people who have not heard of video games before. I had to start with a video game is an interactive media. But for those who play it, know that it's important to all of us. We came here, we were in a movie theater, we are on stream, and we do this because we love it. And we have all these experiences, all this time that I have spent all over the country and all over, especially this region, meeting people that I otherwise wouldn't have met through Super Smash Brothers. And I think overall that could be a part of any game, but Smash especially is one of those communities that is built on the fact that we meet people and we get to know them for the love of our game. All right, so here is what I'm going to talk about today. Our knowledge, where I hope you guys can gain some knowledge on medical professionals' role in gaming, and especially in the esports industry. I hope that you guys can take away what is esports health and what are our best practices, and to answer any of your questions. I don't have a clicker, but we're just gonna kind of just keep next slide. All right. So what is esports? It's organized competitive video games. The most common games that are played are League of Legends, Apex, CSGO, Fortnite, Smash, and there is so much more. Obviously, we have Zane here celebrating after his Genesis win. And our next slide, please. So 3 billion gamers worldwide, 64% of American households own a video game device, and 60% of Americans play video games. And there are $60.4 billion in the video game industry since 2021. Obviously, a lot of money in that. Next slide, please. So getting to the point here of what is my role? What can I actually do as an OT? Well, my role is to help you guys keep your hands healthy, help you focus on mental health, help you be able to sleep, get what you're doing to take care of yourself. But it's not just me. There is a holistic approach to the way that we need to take care of ourselves. You have our vision specialists, medical specialties, physical conditioning, sports science, nutrition, and mental health. And the idea being that all of us should be able to play at our best. The key deficit, or the reason why any of this matters is because I was so tired of the stereotype that gamers, they're just in the basement, they live by themselves, they vision problems, they have hand problems, and then who did they go see? That was the gap. And I said, well, that sounds a whole lot like what I'm supposed to be doing as an occupational therapist. That if I see you and you are coming back from any other job and you tell me that my hands hurt because I'm on the keyboard all day, that is just as valid as if you need to play Smash and you have a tournament this weekend, and how are you going to be best prepared for that? And how are you going to have as least hand pain as possible? Next slide, please. So once again, the health concerns that I address most of the time is mental health, musculoskeletal, sleep, low vision, and exercise. Next slide. So mental health. One of the things that I think gets completely overlooked especially when talking about esports health, is how do you feel when you play? How many of us all say, God, I hate this game, but maybe mean it, maybe don't mean it. But the point, if you are feeling kind of burnt out, how do you get back into it? What are our motivational strategies to help us feel and play at our best? We feel when we play confident, we play better. There are the strategies that I like to focus on are focus and attention, breathing techniques, visualization, and social outlets as well. Are you journaling? Are you writing your thoughts when you play? That's a really effective strategy, especially if you know that you are not having a good day to play. You probably should not play. You are going to make it worse. If you are having a good day, what made it a good day? Were you just playing, were you playing online arenas? Were you playing with your friends? Write down what makes something fun for you fun. Those will help you in the long run to be able to play at your best more often. Next slide, please. Obviously, the most common conditions that I address are depression and anxiety, social isolation, gaming disorder is the common category in the DSM currently. It's a little controversial due to it being pretty much like under the classification of like gambling, but it's more or less it's disputed. But what's not disputed is going to be like depression and anxiety. There is inherently in any competition a lot of anxiety. Tournament nerves is like the coined term in the Smash scene for if you are feeling nervous about to play Psychot, about to play Sam, that if you're a newer player, like how do you go in it to play your best? Are you going into it like, oh, I'm gonna lose, or are you gonna go into it feeling like, I'm just gonna go and play the best I can? How are you going to adjust that mindset to be able to play and not let yourself get down? Social isolation is also one of the most common things. A lot of times these players are playing 8 to 10 hours, there is no sunlight, there is no grass, and you also need to check in on your friends. How are they doing? Go out, go for their gym, go get a cup of coffee, go out and call a friend even, message someone on Discord, whatever you need to do to just take a little bit step away from the game for a little bit and be able to interact with your friends who also make the game special to you. All right, next. So here is one of the best things, and I touched on some of these already. Breathing exercises is huge. I mean, how many times are you in the respawn platform and Smash and just say, all right, take a breath. I'm gonna get back into this. If you're me and you're playing Rob, drop from platform, grab gyro, let's go. I'm down 2 stocks, doesn't matter. All right, adequate sleep. How many people in here got 8 hours of sleep today? Let's see. 1, 2, 3, 4. How many people got less than 8 hours of sleep? There's the whole room. So there is mountains and mountains of evidence that show lower cognitive function whenever you are not able to, when you're not adequately rested. That you have a slower reaction time. You are not as able to move or have as clear thinking. Problem-solving skills are way lower. And if you're adding stress on top of that, you're only diminishing those skills further. Another way to address those things is, there's a whole slide on sleep, but all of this is to say, please try your best. We all have lives outside of this. However, if you are in a competition, it is without a doubt critical that you get as much sleep as you can. I'm not going to point out anybody. There is a certain top player here who plays Samus that tells me the most horrific sleep schedule I've ever heard in my life. Next slide, please. Vision. Next slide. So, yeah, did you guys think I was kidding about the raccoons? 20-20-20 rule is a really quick and easy way, especially during a grind session, to put into practice. For every 20 minutes of play, look at a different object 20 feet away. I've had patients put like a poster up on their wall. They could put like a dot. It could be any object that you want, a chair that you put on the other side of the room that just lets you look at that object for 20 seconds, reset your eyes, and go back to playing after that 20 seconds. Set a timer. We all have a little smartwatch, and maybe it's not even every 20 minutes, it's every 3 to 5 games. It's after a best of 5. It's after, like I'm getting some eye strain, I really need a little bit of a break. This is a really quick and easy way to address it. Next slide, please. All right, the common vision problems I see is digital eye strain. We are looking at a bright screen we got here at 10, and we will be leaving at what time? And we're going to be looking at bright screens for a while. So we really need to make sure that we're stepping away. We blink. We do what we need. We do that 20/20 rule to be able to address those concerns. Other ones that I see is convergence and sufficiency. That is when the eye muscles in the eye. If you remember like a doctor in school or the nurse in school like brought a pencil or like a marker like close to your eye to see like cross-eyed. If you have convergence and insufficiency, you are unable to do that. And what it causes is double vision, and it would look like you see two screens playing at the same time if your eyes aren't able to focus on an object at the same time. Blurry vision comes from the eye strain, comes from looking at a screen for a long period of time, and we also know that when you're playing for a long time, you're not blinking. It's going to cause your dry eyes, and that's when I would say over-the-counter eye drops can work. If you have any other external vision concerns, I would speak more to like a healthcare specialty that focuses in the eyes. Ophthalmologist or whoever you see for your eyes would probably be the best. For anything outside, that's real quick strategies for bracket. Here is a more thorough 20-second break for every 20 minutes, looking at something 20 feet away. It really doesn't need to be too specific or a certain size or anything like that. More strategies. Some of the other things I recommended before are like those blue light filter glasses that like adjust to like low light that turn like yellow. You might see players like Wizrobe in the Melee scene that wears them, and I'm sure there are other players too that use them too. Talk to your eye care doctor if that's something that might be interesting to you. It benefits people a fair bit. I've seen good results from it. Schedule breaks. This is the hardest for all of us, especially for like just one more game type games like Smash, where it's hard. So what I recommend just as a player knowing it, all right, after this best of 3, I'm going to go take a 10-minute break. After this best of 5, first to 5, however you want to space it out, just give yourself a distinguished routine that I know I'm going to take a break after this set period of time. All right, let's get to the big one, hands. All right, musculoskeletal conditions that I want to address first and foremost. Believe it or not, for video game related injuries, in the literature that I read, only 22% of players report hand problems. The majority of the pain that players feel is in the head, back, and neck. Now, you guys can't see me on camera on stream, but this is a really, really easy way to explain why. Take like 3 seconds here. We sit like this. We walk in. And we sit like crab or shrimp. So if you go when you're walked in and you lean forward like that, you're putting that extra strain on your neck and on your back, and it's causing that pain that you feel, and is almost nearly half of the conditions that I've seen in the literature. 10% for other is like any extraneous condition that like might cause difficulty playing the game that's like pretty external to esports, like rest in peace, Brawley Hands. That's like other, where he had like a global condition that affected his hand severely. He played with his mouth. He was awesome. And spinal biff, quadriplegia, other conditions that like really inhibit your ability to play is in that other category. All right, so I briefly addressed it. Whenever you like are in that locked in position, is like the upper cross syndrome is the name of it. It's when you get like the tight flexors in the neck or lower neck and the upper back. It causes similar feeling if you like imagine if you're in the gym for like you're doing like low back, you're like doing a pull-up bar, and you like feel that pain in the upper back. It's like that, but like constant. And the best way to address that is like higher back support, stretches, rolling the shoulders a fair bit is a good one to address that. Tension type headaches. I have seen a lot of players who are very dehydrated with migraines that play this game at 10 in the morning and have a headache. And also we are in a loud room. There's a lot of people around. It's going to cause that like frontal lobe or type headache. The best way to address that very quickly, water, please drink water, icy mist. I'm not afraid to just call that one out on the mic. but that's a really good one to address that. If you have any other external medications, please see your doctor for that one. I'm not going to publicly say a solution to that one specifically. Up next, so like I said, gaming type headaches are usually related to tension. There's some evidence to say that like lighting can cause it too. Like intense overhead lighting has been shown to cause a fair bit of headache due to, it's honestly unclear in the literature as to why, but it has been demonstrated that if you have like bright lights on you, it can cause those headaches. Now, the solution to that is going to be variable. We play a game that is literally flashing lights. So the best way to really address that is you can practice and prepare. You can, not play in the dark all the time. You can just, blink for a bit. You can do some of those eye exercises. If it's really something that's bothering you, you might have to request maybe not play on stream until you are ready to play and you have a decrease in pain. All right, so wrist pain that I see. So this one, that like fancy word, extensor carpal ulnaris tendinopathitis is the full name of that. And it has to do with pain that comes from like stretching your hands out. We play a game where our hands are out, and if you're on the keyboard a whole lot, you might get pain through there. Intersection syndrome is pain through the thumb. Gamer's wrist is a way more easy name for wrist pain that comes specifically from playing games at a high APM. Carpal tunnel, I think I have a next slide that is exactly, it is so misdiagnosed, it's insane. Over 90% of clinicians will diagnose carpal tunnel for any like generic wrist pain without actually going through like different testing for it. Carpal tunnel is a nerve injury. It's caused from compression of the median nerve. Now, the way to distinguish it is if you have like pins and needles feelings in your hands, like it feels like your hand's falling asleep when you play, that's more likely carpal tunnel. The pain that you feel is like a muscle strain, which is way different, which is way more treatable, which is way more easy to address, and you will get back to playing far faster than carpal tunnel, which is a little bit of a slower process. You're still able to address it, but they're completely different. So one of the reason I bring this up is because so many Smash players will like, just stereotype for a little bit, like Fox players. Oh, you're gonna give yourself carpal tunnel. For Ultimate Peach, I'm gonna give myself carpal tunnel. All right, we're gonna keep going. Gamer's wrist, overuse injury. I talked a little bit about that. Next slide, please. Additional support will be like a gamer pillow. If you have a pillow that you can bring with you to rest your hands is really good. Next slide, please. Xander's giving me a little bit of a next slide, so we're going to keep going for a little bit. Supports and treatment. All right, so keyboards. There are all kinds of ergonomic keyboards that you can use. This is more not really so much related to Smash, but something that can be look up. You can do like keybinds. You can do different macros if they're allowed for your particular game. There are so many supports. There are so many things that you can get that might be able to help your hands. I don't know what any of that means on there, but maybe somebody in chat can tell me about what those macros do. If they're important and they help you and your hands are in a better position, they're pretty decent. Like, I do like them. It is an option. You're able to afford it and you're able to take care of your hands that way. It's nice. I have a slide talking about different grips. Next slide. I have a really wonky grip when I play. I took a picture of my hands. I do a modified joystick grip. You can say what you want, but I'm still top in my region. I had my mom take it. Posture. Shout outs to J Mook here. Best posture possible. You want as much upper back support as you can. It's more, you want to make sure that you're really like, it should feel like you're leaning back more so than anything. You want your shoulders relaxed. You want to be able to be in a comfortable position. You just don't want yourself to be leaned forward, especially if you already have underlying pain. All right, so I did a little checklist. This is once again a shout out to 1HP. Thank you, Dr. Hugh, for having this image. Once again, you see that like straight, relaxed shoulders, lower back. He has like a good upper, this is that crab posture, the shrimp posture I talk about. You might be locked in, but it's pretty painful long term. Stretches. All right, boys and girls, let's learn some stretches together. All right, there's some next stretches. If you want to do some more stretches, this is going to be something where at my table where I would love to see you. Finger stretches to do, hand strengthening. All right, I have some quick beef. Do not get this lower one. If you're playing, please, for the love of God, do not get this unless you're doing some really specific weight training. I do not know why you need like a 50-pound grip to squeeze before playing Smash. I promise you, rubber bands and therapy is so much better, and you are going to get so much, like, you will get the improvement you're looking for. Those just hurt. All right, sleep. Please sleep. Please sleep. All right, exercise. Please exercise. Xander's yelling at me. Please. All right, Q&A. How long do I have, or am I over?
If you want to ask that questions, you'll be sitting at the table over here.
All right, thank you guys so much for your time. Thank you, Xander. Thank you, VGBootCamp. Thank you, everybody. Please go and see me. I'd love to go and talk to you guys.